Hey guys, Dr. Joe here, and my buddy Charlie, and I want to talk to you about blood pressure. So people check their blood pressure, and they look at the top number systolic over the bottom number diastolic, and what that means is the top number, which is usually bigger, or it should be, is when your heart is squeezing, and the lower number is when your heart is relaxing. The difference between those numbers, forget their absolute number, so let's say 120 over 80, okay, which is deemed normal these days. The difference between them is 40, okay? If you subtract the bottom number from the top number, you got 40. Math quiz. That's what's called your pulse pressure. A maximum or a threshold pulse pressure of health is about 49 to 50. Anything above that, so let's say your blood pressure is 170 over 90, that's a big difference. That's an 80 pulse pressure. That can indicate that you have inelastic or non-flexible arteries and blood vessels. And when that happens, your blood pressure rises. But what causes that? Usually inflammation from foods, things, stress, life, not enough sleep, poor diet, and too much processed sugars and insulin insensitivity. And what happens is those sugars bang around in your body, insulin sensitivity, and it causes a lot of, well, I'm not going to get into it, but a lot of havoc in your blood system. And that causes your arteries to get harder and thicker, and they're not as flexible. And when that happens, your blood pressure itself goes up. Your health and risk of heart disease goes up. So control your sugars, control your insulin sensitivity, move your body, exercise, and start paying attention to the pulse pressure, which is the number between the top and the bottom number of your blood pressure.